Good evening. Good evening, good evening, good evening. I am Frank D. Dorsey II, Associate Director of Student Engagement for the Division of Student Affairs. At JCSU, I have the pleasure of working with students in the Office of Student Leadership and Engagement. However, tonight we're gathering to give special attention to the increasing concerns of our students' parents and caregivers. We appreciate your participation this evening and look forward to more opportunities to engage in the very near future. We will now start this presentation off by hearing from our university president, President Armster.
Thank you, Mr. Dorsey. Can everyone hear me? Can you hear me now, Mr. Dorsey?
Yes.
Thank you. I just want to make sure. Good evening, everyone, and welcome to our Golden Bowl families, parents, and students. We're delighted they have the opportunity to speak with you tonight. You're going to get a full presentation from our reopening task force, and they'll be available to answer any questions you may have. As you know, this pandemic has been something that none of us have been able to control. And it has changed significantly since the last time we spoke together, I think in November 2nd, I believe, when we had one of our earlier town hall meetings. Among the things you'll hear tonight are our latest plans for the reopening of campus. We are still hopeful and prayerful that we'll be able to do that. In large part because we know, as we've heard from many of the students, I was on a call last night, and I saw some of them on the call already tonight with the leadership of our student body, our Student Government Association, our class representatives, and our Royal Court. And we all know that for all things being equal, most students would rather be on campus learning, and quite frankly, we would prefer that as well. So I'm not going to get a lot into any details in my opening comments other than say to welcome you. You are going to be in very good hands. You'll hear about our reopening plans. Feel free to ask questions. And we are hopeful and prayerful that we will see you here at 100 Beatty Ford Road sometime in the early part of 2021. With that, Mr. Dorsey, I'm going to turn it back to you. I am going to have to step off the call for a time. I have to get on another call, but I hope to return before the conclusion of tonight's meeting. Thank you very much. And again, welcome.
Good evening, everyone. My name is Latrell McAllister, and I am the Vice President for Administrative Services and one of the chairs of the Reopening Task Force. And so I'd like to talk to you about the safety precautions the university has put in place to prevent the spread of COVID. Next slide. The students at Johnson C. Smith that will be returning in the spring will receive safety kits similar to the one that you see on your screen. I have one here with me today. It will have in it 2 JCSU cloth masks, hand sanitizer, a door opener and door tool, a digital thermometer, and a card that helps you become aware of the washing your hands frequently, wearing your mask, and waiting so that there are 6 feet between you and the next person. Next slide. During this time, we have been gathering and purchasing and investing in a great deal of personal protective equipment. You'll see on the slide that we have quite a few masks and a variety of masks. We have N95 masks and KN95 masks for our frontline employees, people in the medical field and in the campus police department. We have additional cloth masks and 3-ply surgical masks so that students, faculty, staff, and visitors on campus that don't have masks can be given masks, because it is our intention to have everyone on campus wearing a mask. We've also accumulated quite a few other personal protective items that will be issued to departments, faculty, staff, and students as needed. And on the next screen, we'll talk a little bit about our daily pre-screening process that's been in place since July of this year. So 7 days a week, we're asking employees, students, and students to take just a few minutes to go through and complete a questionnaire that's in SensorRx. And SensorRx is a web-based module that allows you to go in, answer several questions about your health, and get a risk assessment. We'll show you a picture of that later. But we're asking everyone to do that every day. And every day that you come to class or that students leave their residence halls, they will be asked to go through a screening, a temperature screening. So we provided several devices, one in most residence halls and 2 additional spaces on campus where you go to the screen that's featured here in the picture. It will take your temperature. And once you take your temperature, you'll be issued a wristband similar to the one that you see in the photo below. Each day, the wristband will have the day of the week printed on it, and it will have a different color. So if a student's temperature is in an acceptable range, and that's lower than 99.1 degrees Fahrenheit, then the students will be able to leave their residence hall and proceed throughout campus for the day. If they receive a yellow or red risk assessment, they will be asked to contact Ms. Marion Jones or a member of the Student Health Center team just as soon as possible. So some parents have said, I keep hearing that my child says that they need to download or save an app. What does that mean? So if we go to the next slide, we'll talk about the apps that we have that we're asking students to download or add to their phones before they come to campus. So the first one is the first thing we're asking students to do is to take and pass a test that is on Canvas, which is our learning-based module, our learning module. And they can take the test as many times as they'd like to take it, but they will have to receive a grade of 100. We want to make sure that everybody knows what's in this learning module. The courses come primarily from the CDC website. So it's mainly important that we have everybody understand what it takes to keep the campus safe. And then they will be able to be asked to complete a student data form in housing, and that will help them to get everything they need lined up and get ready to come to campus for move-in. Okay. On the next slide, we talk about SensorRx. And SensorRx is a program that is required for our students. If you look at the picture, it shows you that this particular person has gone through and answered questions about whether or not they have a headache, if they have a sore throat, if they have a cough, if they have a temperature. And based on the answers to their questions, this particular person has received a green risk rating. With this on their phone or on their laptop or on their tablet, they come to campus, present this at one of the check-in stations, and that's where they are given the wristband to proceed for the rest of the day. We're asking everybody to complete the screening every day. Why are we doing that if you're not in campus? If you're not in classes on Saturday and Sunday? Well, because you will be in the cafeteria on Saturday and Sunday. And so whenever you move about campus, we're asking you to assure one another that you don't have any of these symptoms, any of the symptoms of COVID. If you receive a red or a yellow risk level, the app will give you information as to what to do next. So you won't have to guess. And then the third app that we're asking you is the Navica mobile app. And that partners with or complements the Binax Now rapid test that we're going to be administering when you come to campus. So and we'll talk more about this. Mr. McPherson will talk more about this when we get to move in. But you will, before you get an opportunity to go to your residence hall, you go to a station where we will be administering rapid test. That test is called the BiNext Now, and you'll need to download this app, set up your profile, and you will then be given your results for your test right there within about 15 minutes using this Navica app. Once you are on campus, taking courses face-to-face and moving about the campus, we'll be doing surveillance testing, and you'll get your surveillance testing results there as well. Okay, next slide. The next slide, we talk about the Canvas course that I mentioned earlier. Parents, this may be a new term for you, but students are used to taking courses and taking care of their business in the Canvas learning module, and it can be accessed through the JCSU web portal. So the students will click on the JCSU Canvas on the left side of the screen. They can review the dashboard, scroll to the student COVID-19 safety course, complete the course, and then sign the campus community pledge at the end of the course. And Dr. Takeem Dean will talk to you in just a bit about that campus pledge. And the final app is suggested but not required. The state of North Carolina has created an app so that we can decide, or we can learn, if we're in the vicinity of a person that's tested positive for COVID-19. So we highly recommend it. It's good when your students are out and about in the city. So it's a free download through the App Store or Google Play, and it's secure and it protects the identity of everyone. So you don't have to worry about your name being broadcast or even your specific location being broadcast, but it gives you an idea about who in your vicinity that's participating in the program has tested positive. And you can enable your Bluetooth and exposure notification settings, and you can share information confidentially that you've tested positive yourself. If you and your students want to learn more about the Slow COVID North Carolina app, Slow COVID NC app, go to the website that's listed on the screen below. I'll pause for just a second to give you an opportunity to copy that down. Okay, and we'll have it for you in the recorded program. On the next slide, we talk about Smithite Care, which is our telehealth program, and we highly recommend the students download this app. This app will allow them to communicate with a nurse, a member of the health center, or a medical professional 24 hours a day, 7 days a week. They'll have access to licensed physicians and mental health counselors. They can communicate with other people on campus, including Campus Health Center and Counseling Center. And they can go to this website and create a free account and utilize Smithite Care. And for the students on the call, we've been reminding you about Smithite Care in JCSU News about weekly. So hopefully you're familiar with that already. Okay, and now I'm going to pass on to my colleague to talk to you about physical enhancements on campus, Ms. Erna Perkins-Jones. Thank you.
Good evening, everyone. And we are excited that you'll be returning to campus. As we prepare for the reopening of campus, we have made some intentional efforts to ensure your safety and enhance the campus as well. The next slide. In the efforts to ensure that to have protocols, we have partnered with a strategic partner, SSC Services Solutions, a division of the Compass Group, who enable us to implement different efforts around the campus, ensuring what you call sanitation needs, as well in the classrooms. We have added directional signage, hand sanitizer stations, and plexiglass barriers. And we have them placed all over the campus and even in the resident hall dorms. So in addition to that, the cleaning and sanitizing, disinfecting will be twice a day efforts, Monday through Saturday. And in the resident halls, we'll do a lot of high touching. And we have a specialized team that's been set aside to ensure sanitation. And in addition to that, the administrative buildings, excuse my dog, will be also enabling us to meet our goals. In the cafeteria area, there will be daily deep cleaning to ensure that everything meets the needs and create a safe, pardon me, needs of the students. And we have reduced the density of the classrooms by removing furniture and creating specialized signage to ensure 6 feet distancing. Next slide, please. And so the highlight of all these improvements on the campus to ensure safety and enhance your learning and living experience, we had other campus improvements. We HVAC to enhance the quality of air filtrations, along with furniture and mattress replacements. And the cafeteria or the dining hall, you'll be greatly surprised when you return to campus. We've done a complete remodel. The picture you see adjacent is an example of what to be expected when you return to campus. In addition to that, we are also doing a front entrance enhancement along with the internal roads and sidewalks. And we will be exploring opportunities for the students to personalize their living spaces. And again, the facilities department looks forward to your return. Thank you.
Good evening, everyone. I'm Marion Jones, Director of Student Health Services. The question is, will the university offer COVID-19 testing? The answer is yes. Next slide, please. Once you return to campus, the health center has clinical permission to perform rapid testing. Atrium will be assisting with administering the tests during move-in. We're using Abbott's Binex Now test, which was given to us by the U.S. Department of Health and Human Services. We have about 6,600 tests at no charge, and it's a 15-minute response time. As was mentioned before, real-time results with the Navica mobile app, and that's why it's very important for you to download that app to your phone, because once you come in, you'll be able to get your results in real time. The testing process will take place at Elon Homes in partnership with Atrium. If you are negative, you will get your Navica app will show your results, as well as you'll get a letter signed by the nurse and a wristband, and you can move into your residence hall. If you're positive, you will have a PCR test that will be given as a follow-up. And if you live within 200-mile radius, you will return home. If you're outside 200-mile radius, you'll move into isolation. Exceptions may be reviewed. And we're highly recommending that you get an annual flu shot. Next slide. We will also be doing routine surveillance testings on faculty, staff, and students. And that will be held in the Family Dollar Room in New Residence Hall. We'll be doing 100 tests per week, and it'll be administered by the Health Center and with some support from Atrium Health. Tests will be for all faculty, staff, and students. We will be assigned to a group at the start of the semester. Refuse to take the test will negate housing for the semester. Will need to leave campus immediately. And this also help identify any potential clusters in any area. Next slide. What if my child is placed in quarantine or isolation? Is there a difference? Yes. Next slide. Quarantine separates and restricts the movement of people who were exposed to contagious disease to see if they become sick. Isolation is separate sick people with a contagious disease from people who are not sick. So you are separating, we are separating you from the sick from the ones that are sick to keep them from getting sick. Next slide. Quarantine students, quarantine period after potential exposure is 14 days. You note this may change given recent guidance by the CDC and the local health department, waiting on guidance according to that. Quarantine is assigned in the residence hall, and you have access to the communal and semi-private restrooms. You can leave the room to get fresh air, but must socially distance and have on a mask, and that's a must. Encouraged to wipe down clean surfaces that are touched often. We also have available a daily telehealth visit by the health center staff, and you have access to Smith-like care. So that means that we'll be contacting you daily to make sure you're doing okay and what your symptoms are. And your meals will be supplied by Perkins, and they will be delivered. And the Housing and Residence Life and Health Center and the Dean of Student will assist. And also there will be coordination of your academic courses and assignments occur between academic affairs and student affairs. We have a total of 62 extra beds in the residence halls and Mosaic for quarantine if feasible. Off-campus commuters and receive care through Smith-like Care, the telehelp, and also you can contact the health center and we follow you that way. And it's a case management and return to class management by the health center. So we will be in contact with you whether you're on campus or off campus. Next slide. Isolation students, it is a minimal period of 10 days, could be longer depending on prognosis. Isolation students will reside in Elon home is 2 modules. Module 1 is for females. Module 2 is for males. It's a total of 50 beds. You have access to communal restrooms. You can leave the room to get fresh air, but must socially distance and have on a mask. Strongly discourage face-to-face contact with non-medical personnel. Encourage to wipe down and clean surfaces that are touched often. That area will be staffed with a nurse 24 hours a day. We'll be checking your temperatures and your oxygen level. We'll administer medication as prescribed if needed. We have a daily visit from our campus physician through telehealth. And also you still have access to Smith-like Care. And again, the coordination of academic courses and assignment will occur between academic affairs and student affairs. And in that area, we have a kitchenette. The food still will be delivered by Perkins. We have a kitchenette where we can prepare the food. And we also have storage for fluids, snacks such as Gatorade, water, etc. And off-campus community students, they receive care through Smith-like Care. And of course, through the health center, we'll also keep communication with you during that time. And as you can see in the corner, there's a picture of what the room will look like in isolation. Next slide. Continuity care for your child. If the student has general medical needs, they can visit the health center, and we have a staff of full-time nurses in that area. We have a physician that comes every day to the health center that can determine the basic health needs and order any other additional COVID-19 testings or other medical services that's needed. In a holistic approach to care through Smith-like Care, which is part of Timely MD, we do follow-up appointments and clearance to class and facilitate special accommodations if needed. Next slide. COVID-19 and health insurance. All undergraduate, domestic, international students have a supplemental plan with the university that covers basic health needs. But it is also a good time to review your personal familiar health insurance plan. If your child is covered or what it covers, make sure they have a copy of their insurance card with them. If your child visits an off-site health provider, pharmacy, or hospital without a referral or prescription from the university physicians, then they may be responsible for an out-of-pocket cost. So that means that they need to call the health center beforehand to check with us to see if it's something that we can do before they go into the emergency room or any other facility if they're going to use the student's insurance. So just to ensure that your child submit the health form and your immunizations to the health center. Next slide. Will the university tell us how many students are ill and how do I and my child stay informed? This is for Ms. Belfield. Thank you.
Good evening. I am Sherry Belfield, Director of University Communications and Marketing. To our families, hello, thank you for joining us, and greetings, Golden Bulls. It is really good to see students this evening. Please know that you are missed. Yes, we are going to do everything that we can to keep you informed. For our families, we know that even though they are young adults, you are concerned about your students and you would like to know what is going on campus. And even for students, we know that you would like to know and keep up with everything that the university is doing to keep you safe. And so these are the mechanisms that we have for doing that. As you know, students, we have JCSU News. It is delivered on Tuesdays and Thursdays. As it stands right now, at the top of JCSU News, we have developed a charge forward section that brings out a different topic that was in the student guide to return to campus so that we can focus on specific topics daily and answer questions there. You already received the student guide back on November the 2nd. As we make changes and updates, you can expect to receive another one of those, probably most likely at the beginning of 2021. If you go to our website, jcsu.edu, you will see right there on the homepage a section that says COVID-19 and a section that says frequently asked questions. You can click there. It is updated in real time. Whenever we receive updates that need to go there, things you need to know immediately, you can always go to the COVID-19 section on the website, and that will always be the most updated information. Follow us on Facebook, Instagram, and Twitter. You can follow the official university sites or a handle, which is at JCS University on all three, Facebook, Instagram, and Twitter. There's a student leadership and engagement, residence life. There are different social media handles throughout the university that have the most updated information. We share information that we put on these handles. So please, by all means, follow us on social media. And the important thing where you will be able to go to find out about the instances of cases, positive cases on the campus, will be in the COVID-19 website. We are developing a specific COVID-19 dashboard. That dashboard will be updated every Tuesday at 2:00 p.m. It will show you the number of students who have tested positive, and it will also cover our commuter students who may have called into the health center to let us know that they have had a positive diagnosis. It will also have a block that will show you the number of positive cases that tested on campus for our faculty, staff, and our vendors, in addition to any faculty, staff, or vendor who called in to the special COVID-19 hotline to report a positive case, and then a total for that week. And the good thing about it is you'll be able to follow any progression of increase or decrease in cases because the week-to-week cumulative will be up under the total for the current week. So our dashboard will be starting as of this week right here, because as some of you know from looking on social media, our men's and women's basketball teams have returned to campus. They have been tested, and you will hear more about that later. And so we will start to put up on Tuesday, December the 8th at 2 p.m. will be the first dashboard that will show you whether or not there have been any positive cases that have occurred during this week. As always, please, please read your JCSU news throughout the holiday, because as long as the university is here until we break for the winter break, we will be sending you the JCSU news on Tuesday and Thursdays, and we will also send you special JCSU news emails with any immediate updates that you need to have. So thank you so much. Have a wonderful holiday season, and we are looking forward to having you back. I'm going to pass it on to my colleague, I believe, Mr. McPherson, who's going to start to talk about returning to campus.
Well, thank you, Sherry. I think this is Dr. Hayward. Dr. Hayward, is this you or is this me?
I think it's me, but we can tag team because you're going to come up right behind me, okay?
Certainly.
All right, so to our parents and our students who are on with us this evening, again, good evening. So when does your child come back to campus? We can proceed. These are the most up-to-date dates, and as reiterated by President Armbruster earlier, they have changed as we have responded to sort of the growth of the virus. So our return to campus dates, on Monday, December 28th, our men and women's basketball teams will return from the extended holiday season and continue with their conditioning and preparation for play in January. Please note, if you are an RA, you will now return on Wednesday, January 23rd. In just a few minutes, my colleague, Dr. Morgan, will talk about some of the academic dates that are interspersed throughout these dates, but we will pause as a community during the week of Saturday, January 30th through Saturday, February 6th for you to return on your assigned day and time. We can proceed to the next slide. But before you come, please make sure that your child has financially cleared. And parents, if you were unaware, this process started on Monday, November 30th. So at this point in time, your child should be working their way through the financial clearance process. Okay, proceed to the next slide. Again, we just want to remind you on the day of arrival. Remember, at this time, you will report to Elon Holmes for initial testing. And in the coming weeks, we will be providing directions as well as some pictures so you know that so you know where you're coming to on campus for testing. I think there was a question in the chat box and we will return to it. Only your child will need to get out of their vehicle to come into the testing facility. Parents or caretakers will need to wait in your vehicles. Once your child walks into the testing area, COVID-19 pre-screening questions may be asked, or they can show their Sensor RX green circle. Their temperature will also be taken, and at that time, a test will be administered. It takes about 15 minutes to get the results, but while they are sitting there waiting, we have implemented a new virtual check-in process thanks to Mr. McPherson and Mr. Rice and our team in Housing and Residence Life. There will be a unique QR code at the table. What that will allow our Housing and Res Life staff to know is that you are here, that you are being tested, and they will be awaiting your arrival. Ms. Jones, and we cannot stress this enough, at the point of results, if you are negative, you will be given clearance and a wristband to move into your residence hall. However, if you test positive, we will follow up with a PCR test. At that point, if you test positive again, if you live within a 200-mile radius, you will be asked to return home. If you live outside of a 200-mile radius, you will be moved immediately into isolation. There will be exceptions considered, but we will only consider those on a case-by-case basis. We can move to the next slide, Mr. Dorsey. And now I'll turn it over to Mr. McPherson.
All right. Thank you, Dr. Hayward. Good evening, everyone. I'm Terry McPherson, Director of Housing and Residence Life. As Dr. Hayward mentioned in one of her slides that the basketball team will return December the 28th, know that we have already successfully checked in nearly 30 men's and women's basketball players who are here on campus right now with us. So we look forward to seeing you guys. There will be an extended move-in process. So soon we will send out the dates for the move-in starting January the 23rd, and we will send out the dates for the students to move in. The first move-in process will be our resident assistants. Following our resident assistants, there will be our students, and it will take place over a 7-day period. During move-in, you are only allowed 2 guests to assist you. So we're going to stick to that. We're going to make sure that there are only 2 guests at a time that assisting you to move in. You will have 2 hours. During that period, we're asking that you bring your own hand trucks. You can also purchase carts and so forth to assist you with move in at that particular time. In our residence halls, all rooms will be single occupancy, and this will allow for us to quarantine in place. We will also have temperature checkpoints. Of course, the campus living environment is separated into 3 areas. You have main campus, you have West Campus, and you also have Mosaic Village. And so we will have temperature checkpoints that was mentioned earlier by Ms. McAllister, where you will have to check on a daily basis, have your temperature check, and receive your wristbands before heading off to class or wherever you may be going for that day. We will also have daily cleaning in the residence halls and even on weekends. One of the things that we will be doing more this year is room inspections frequently, just to keep up the cleanliness because of the spread of COVID. So we will have room inspections, and we will notify you that we are inspecting rooms, and we're going to come around. So we expect that everyone will keep their areas tidy and in good order. We're asking that you retain 1 bag. So when you come in, you're going to be given a bag, a duffel bag. And we're asking that you take that bag and put in some overnight gear in the event that you test and you test positive and you have to quickly move to isolation. And so we want you to have that bag to include clothing, hygiene, bedding, if you have to move to isolation. You would also be allowed to bring your iPad, your laptops, and your charging cords, the things that you will need while you're down there so that you can continue to take your classes. No guest and visitation policy. And I'm going to make sure that I emphasize that, because we will be adhering to that policy to make sure that at this particular time, we will not be allowing guests and visitation because of the spread of COVID. And we want to make sure that if someone does become positive, that we also are able to contact trace. And so without having guest visitation, that will reduce the ability to spread COVID. Next slide, please. What if I arrive to Charlotte a day early? It's probably important that you arrive a day early, because as far as check-in is concerned, the first thing that you will have to do is test. Your testing time will be tied to your check-in time. So when we send out our room assignment letters, we're going to start sending them out next week. The delay in sending out housing assignment letters is we wanted to make sure that we had the dates secured that students will be returning in January. Now that those dates are being announced, we will start sending out our room assignment letters. And if you should arrive in Charlotte, parents, if you should arrive in Charlotte a day early, our next slide will give you a link, and you can take your camera phone or, write this down. We'll give you a few seconds to write this down. And I believe it's on our website that we are giving you area hotels that are close to campus. The one good thing about Charlotte, there are plenty of hotels in the uptown area and restaurants and so forth for you to stay. So we'll give them a few minutes, Mr. Dorsey, just to jot this down or to take their cameras and take a snapshot of this. Okay, and I will pass it along to Dr. Morgan.
Thank you, Mr. Mack. Good evening, everyone. I am Dr. Karen Morgan. I'm your Senior Vice President for Academic Affairs. And so I want to take some time to talk about what the classroom experience will look like for your child during the spring 2021 semester. And I want to start out with what an abbreviated academic calendar will look like. So I'll highlight some of the important academic dates on the next slide. The first day of online teaching and learning will begin on Monday, January 11th. And we will continue that throughout the month of January. But the first day of face-to-face teaching and learning will be Monday, February 8th. And as you arrive on campus, as students arrive on campus, we'll have set up across campus some information booths so that you can stop in and ask any additional questions that you might have. We also built in bull break days. Since we will have no spring break in spring 2021, we have 3 bull break days. They are Thursday, February 18th, Tuesday, March 9th, and Wednesday, March 10th. We'll keep our Good Friday holiday and our Easter Monday holiday, which will be Friday, April 2nd, and Monday, April 5th. Please understand that the last day of classes is scheduled for Saturday, May 1st. And then after that, we'll have a reading day on Monday, May 3rd, followed by 2 days of final exams, Tuesday, May 4th, and Wednesday, May 5th. We'll then have another reading day so that you can prepare for additional exams on Thursday, May 6th, and that will be followed by 2 additional days of final exams, Friday, May 7th, and Saturday, May 8th. And about a week later, we will have commencement, which is scheduled for Sunday, May 16th. As we go to the next slide and look at how the classrooms will be set up, Ms. Erna Perkins-Jones mentioned this earlier. There will be plexiglass barriers placed on podiums and presentation desks in classroom spaces and laboratory spaces. Your faculty members will assign seating so that will help facilitate contact tracing. In addition to that, all of your classes will be adjusted to end 10 minutes early to allow you to clean and disinfect your study spaces, your learning spaces, and for faculty to clean and disinfect their instructional spaces. And also there will be wipes, disposable gloves, and hand sanitizer stations available. So once you have cleaned your particular station, you leave, and then as the classroom is empty, the next class will be able to come in. We also have paid attention and made a significant investment in some instructional technology. In addition to what you will see in some of the classrooms, there will be cameras and other technology available to help us enhance the teaching and learning environment. We also have installed electronic card access for 6 of our academic buildings. And in the next slide, we'll talk about the class model that we're using. Perhaps you've heard about it already, but we will institute a gold, blue, and white cohort model for students. The gold and blue student cohorts are those students who will alternate on a weekly basis, meeting in the classroom space with their professors, while the other cohort joins virtually. In addition to that, we will have a white cohort for students, and that particular student cohort will meet virtually for the entire semester. If your class is scheduled, let's say it's Monday, Wednesday, Friday from 11 to 11:50, even if you are in the white cohort, or if you're in one of the cohorts that will be alternating and meeting virtually, you will meet the class at the specified time. But we will have supplemented for each of those courses, there will be a supplement of asynchronous strategies. So we will have pre-recorded lectures or real-time lectures that will be available for you at a later time after your class will have met. In addition to that, all of our Wednesday classes will be held virtually. And there may be some exceptions to this, and we think about those classes that are in our evening online program, or for students who are in our master's degree program in social work, there may be some exceptions. As we talk about the white cohort model, which is what I mentioned in the next slide, I'll talk about it a little more in the next slide. The white cohort for students, once again, those students will meet virtually for the entire semester. But we have used 3 broad categories to determine the eligibility for those students who will be in the white cohort for spring 2021. If we have students who are at higher risk for any kind of severe health complications from COVID-19 exposure, they will reach out to the University Student Health Center. The phone number is given there, and the email address is also provided for your convenience. If you are a student, or for parents or caretakers, if you have a student who has a documented different disability, you will contact the Office of Equity and Access, and that is the contact information that's given. All other matters which do not fall within categories 1 or 2, feel free to reach out to my office, and that contact information is given, but you can also email svpaa@jcsu.edu. Some students have already received responses to their requests to be in the white cohort for spring 2021 semester. And for those students and parents, so that you will know, or caretakers, those students received an email, joint email from Dr. Davida L. Haywood, who is our Vice President for Student Affairs, and myself. And that email was sent to the student's mymail.jcsu.edu email account. And also, if those students are going to be moved to the white cohort, the Office of the Registrar will work with my area and with Student Affairs to make sure that those students are put into the white cohort if necessary. And so, if you want to get familiar with our campus, we invite you to take a virtual tour by visiting this link, which is located on our main webpage. And it's a beautiful virtual tour, and it doesn't take very long, but you're able to watch it as many times as you like. So feel free to take our JCSU virtual tour. Angela, for those students who have not received a response, if those responses came in within the past couple of days or so, those responses will be going out to you within the next few days. And I can say to you, if it's about academic matters, we are not denying the request for students who have indicated that they have some concerns about attending classes face-to-face. And I also want to add that if there are any students who are living in the residence halls who have been deemed eligible to be in the white cohort, you may still stay in the residence halls for spring 2021. And so Dr. Dean, who is our Dean of Students, will now talk about what the dining experience is going to look like on campus.
Good evening, everyone. I know this has been a lot of information. I'm here to share some exciting news about the dining hall. You know, students who are returning have been providing feedback regarding the dining experience and how they would like to see some enhancements. And Ms. Erna Perkins-Jones, our Director of Facilities, mentioned the enhancement earlier. So on the next slide, I just want to talk to you about what the dining hall experience will look like. Again, not to repeat what Ms. Perkins-Jones talked about, but the dining hall is going through a major facelift. You will be pleased, new and returning students, when you come back to see the facelift that's happening in the dining hall. But just some other important things is that know that there'll be some dedicated doors for entering and exiting in the building. There'll be signage, as was mentioned earlier. There'll be plenty of hand sanitizing stations. And of course, we have our restrooms for hand washing. And there'll be plexiglass throughout the facility in front of all food stations throughout the dining hall. None of the food stations will be self-serve. It'll all be served by staff in our dining facility. The staff that works in the dining hall through Perkins Food Management will go through their own set of precautions as it relates to wearing PPE, washing their hands, taking temperature, along with the university standards of taking their temperatures when they get to campus and wearing the appropriate wristbands for that day. So that staff will follow the same protocols that we follow as staff members. Cleaning and sanitizing, as well as disinfecting, will happen every 30 minutes in all of our dining facilities. And there'll be routine cleaning of doors and other high contact surfaces. And once students leave a a table from the dining facility, the staff will then disinfect and sanitize that table so that the next set of students can sit at that table. We're going to reduce the capacity for eating. And so, in the past for returners, the dining hall capacity will not look how it looked in previous years because we want to reduce that density. And so tables will be spread 6 feet apart. There will not be as many chairs at tables, just so that we're practicing social distancing in our dining facility. And while you're eating, it's probably the only time that you can take off your mask to enjoy your meal, whether it's for breakfast, lunch, or dinner. During meal times, we'll be providing disposable plates, cups, and cutlery. And so you can dispose of those things in the appropriate places within the dining facility. Again, no self-serving, no buffet style eating. Everything will be served to you once you go through the station that you choose to go through. We'll have beverage stations, but they'll be manned by an attendant. So you will no longer just bring your cup up and get your own drink. We'll have someone serve that to you. And we'll also be looking at some options of having canned or bottled beverages in the dining facility. We'll have plenty grab and go options. And so Lorraine's will be one of our options. We'll also have the grab and go that we offered this past academic year, or last academic year, outside the dining facility. And also we'll have Kokomo's and Red Mango. And we're looking forward to having Pizza Hut on campus. So no more Burger King. Pizza Hut will replace Burger King in January. And we have been having constant conversation with Perkins Food Management, and they are on schedule to have Pizza Hut up and running. Another exciting thing, the Student Government Association has been asking, along with JABAC, has been asking about food trucks on campus. And so beginning in January, we'll be offering 2 food truck nights a month on campus. So you have any ideas of any local food trucks in the city of Charlotte, please share that with Mr. Dorsey and Mr. Tate so they can reach out to those vendors and we can set that schedule up as soon as possible. Another highlight is that we're offering more picnic tables and outdoor seating so that if it's a nice day outside, you do not have to eat your meal inside the dining hall or one of the dining facilities. You can take your meal outside and enjoy it with a friend or two, of course, appropriately social distancing at the picnic or outdoor seating area. On the next slide, it will highlight what our dining hall hours, and these are the hours for the main dining hall, which is the Millennium Dining Hall hours. And so Monday through Friday, we'll serve again our breakfast, lunch, and dinner. And then on Saturday and Sunday, we'll follow a brunch and dinner schedule, as well as on days where there's no class in session, there'll be a brunch and dinner schedule on those days. So some exciting things happening in the dining facility, and we're sure that you'll enjoy it once you return.
So again, we agree that you all have heard a lot of information, but we want to hone in on some other services that we will continue to offer when we open up in the spring. We can proceed, Mr. Dorsey. Just a couple of things. Counseling services is always available. You've heard Nurse Jones talk about Smithite Care. Our counselors, led by Ms. Parsons, they are still taking appointments. If you need resources or services, feel free to reach out to them. Tutoring and advising is already occurring, and we'll talk about that in just a second. Most of these appointments in terms of engaging with your advisors are happening via Zoom. Our Healthplex will reopen. This is our gymnasium, our health facility for our students here on campus. They will operate with the hours of 6:30 a.m. Until 8 p.m., but there will be a 12-person maximum. You will have to schedule an appointment to work out. We certainly want you to maintain your health during this time. And just so you know, when you come into this space, you will see lots of cleaning happening. There will be cleaning every hour on the hour. Student engagement, courtesy of Mr. Dorsey as well as Mr. Tate, will still occur. We're just going to have to get creative. You will still see a lot of virtual programming that will be offered a number of times throughout the day and weekly. We are exploring opportunities to socially distance in some of the very large spaces here on campus to have, if you will, some walk by and drive by events. For our students who may need accommodations that are in alignment with ADA and 504 plans, Dr. Morgan has placed down in the chat box the information for our Office of Equity and Access. If you are in need of accommodations, please do not wait until the last minute to request them. We will try to accommodate you as such. And then if there are any international students on our call, or perhaps you will look at this on YouTube, please stay in touch with our registrar's office, Ms. Keisha Wilson, who is our registrar. This is very important, particularly as we think about traveling and whether countries are allowing individuals to travel outside of their native countries, and or if there's an opportunity that you will not be permitted back in once you leave. So please stay in contact with Ms. Wilson, and her email address is there. Next slide, Mr. Dorsey. And parents, again, we've given you a number of dates. A lot of this work has already commenced. So if your child has not taken advantage of these dates, please encourage them to do so. If you are a graduating senior, you know that the dates for your advising and registration opened on November 16th. If you're not a graduating senior, then you have been able to access your courses and registration processes starting 2 days later on the 18th. If you were a senior and you were planning to graduate in December, November 20th was the last day to file for a December graduation. And as we stated earlier, the financial clearance process has started, and VP Petsky is on this call. And I know there are a few questions concerning payments and discounts, but the clearance process started on Monday, this past Monday, November 30th. You can proceed, Mr. Dorsey. I'm going to turn it back over to Dr. Dean, who's going to talk to you about how we are going to enforce our precautions for COVID-19.
So one of the things that Ms. McAllister mentioned is the COVID-19 student safety course that each student is required to take. We're asking students to take this course prior to your check-in process, the date that you are scheduled to check into the residence hall. So all of you will be inputted into the course most likely at the beginning of January. This course will have information about COVID-19, stuff that you've already heard. Within the course, you have to pass 2 quizzes and also sign the community pledge. And you can take the quizzes as many times as you need to get a 10 out of 10 on the quizzes. One of the important things is the community pledge. The community pledge is for all faculty, students, and staff on campus. It is our pledge to ourselves and, more importantly, to each other. And how do we keep our campus safe and help mitigate the spread of the virus on our campus? And so we ask that you not only that you just don't sign the pledge, but you read the pledge, and it's something that you are agreeing to do on campus. If those things do not happen, then we need to have some conversations with you regarding behavior that you are displaying that's not in concert with the community pledge and what we said we would do as a community, such as wearing masks and socially distancing on campus. The student handbook is on the portal as well as on the website, and it's also on our COVID-19 section of the website. Please, please, please make sure you are reading the handbook. I know that's another reading assignment, but we're asking you to read the handbook to be familiarized with the contents of it. There's some modifications to the handbook that we'll be publishing really soon as it relates to COVID-19. And so you'll see that coming from the Office of Student Conduct in the coming weeks regarding some addendum to the student handbook. And just want to, make a serious point that, as it relates to the pledge, if there are behaviors that you are displaying that, again, are not in concert with the pledge or even the student code of conduct, please note that at any point we may ask you to leave campus. If you are in violation of the mask policy, the community pledge, you may not go through the traditional student conduct process. Ms. Razor, our coordinator of student conduct, or myself may have to ask you to leave campus because you're not doing what you need to do. But we hope that we don't have to get to that point, that we will be responsible to wear our masks, wash our hands, social distance on the campus. And if you see others not doing those things, we have a commitment to each other to say, hey, you need to have your mask on. Because we want to make sure that we are, keeping the campus safe and, again, helping to mitigate the spread of the virus on our campus.
So parents and students, we're so glad that we have so many of you participating this evening. This is really, really important information. Many people throughout the college campus have spent, excuse me, the summer and now the fall planning for you. And as you can see, our plan is very colorful. We have red, yellow, and green risk alerts when we check in through our COVID app. We have gold, blue, and white cohorts as we look at our educational and academic process. I'm going to talk to you about some other colors now. The university, what happens if the university has to close down? We have come up with several alert levels, starting with the green level. And so when you come in, we anticipate that, we won't have a lot of positive cases on campus because of the entrance testing. So the transmission rate will be low. And we're asking everybody, faculty, staff, and students to complete the COVID-19 test in campus so that everyone's doing what they're supposed to do. We're asking people to take the pledge, practice their social distancing, hand washing. So we hope that most of that will go very well and people will do what they've been asked to do or taught to do. But we do anticipate, based on experiences at other colleges, that there may be times when we have to increase our precautions or tighten down on some things that are happening. So, for instance, we may have to reduce the number of people in assemblies. We may have to reduce the number of people that are allowed to gather and I guess really kind of converse with one another, speak with one another in smaller groups. We may have to reduce the campus density. Right now, our faculty and staff, many of them are still working remotely. All of our faculty are. Many of our staff are still working remotely. So there may be a time when we have to ask other people to work remotely from home so that the number of people on campus is lower. And that will hopefully decrease the number or the spread of COVID-19 on campus. Throughout, we are discouraging people from traveling. We have said right now we put prohibitions on business travel. We're discouraging students from traveling back and forth home. And as you can see, we've taken out spring break to discourage students from traveling there. We know it's tough, but this is really, really important. And this is what the public health officials have talked to us about. Next slide, please. So as the incidences of COVID-19 increase on campus, we expect that we'll see more students in our isolation and in our quarantine housing. And we'll have to keep track of that, as Ms. Belfield said earlier, as we look at them, and those will be internal numbers. We will not publish that externally, but we want to make sure that our goal is to keep our number of positive tests each week to no more than about 3% positive tests per week. And we're looking to try to make sure that we have at least 50% capacity in our isolation spaces and in our quarantine spaces. But if the number of cases increase, we may have to make other adjustments, in our plan and in our operations. So the red level is really where we found ourselves last spring, in March. We may find ourselves in a position where the mayor or the governor decides that we need to roll back some of the privileges that we have. They may be closing down certain businesses. Airports and travel may be restricted. And in this instance, you can expect us to go back to all online classes, and then we'll probably work to begin to return students home. Students who are ill, if they're in isolation, we will stay here until the last student is well and out of isolation. So you don't have to worry about that. But if your student is well and can travel for their safety and the safety of others, we may start alerting students that they should make plans to return home. So parents, you know the saying, if you fail to plan, you plan to fail. And so we want to make sure that you have a plan with your students in case something does happen and they have to return to return home quickly. So talk about what your plans will be, if you have relatives in the area, if they can go to relatives' homes or whatever. But we do want you to begin, even as you bring your students to campus, begin to talk about a plan for if the students have to return back home. Okay, all right. So now I believe we're at the point where we have questions and answers. I imagine that the group has quite a few. I've seen some come up in the chat. Mr. Dorsey, are you monitoring the chat for us? Can you tell us about the questions that we haven't answered so far?
Greetings and good evening. Once again, I was not able to monitor the chat while switching the slides, but I will invite the participants to come off of mute and ask questions they feel that may not have been answered during the presentation.
Okay, thank you.
Good evening. My name is Montgomery. I have a sophomore, and first of all, I want to tell you that I thought the meeting was very informative, so I appreciate the opportunity to get the information from you. So great job on that. Just two questions about testing. The PCR test the first question is the accuracy of the rapid test that is given to students upon check-in. And then the PCR test, should they test positive and have to have the PCR test, how long does it take to get those results back?
Mm-hmm. Dr. Haywood, do you want me to take a stab at that, or Ms. Jones?
Yeah, and then I'll yield to Ms. Jones. And if either one of you would just address the accuracy question as we engage with Atrium.
Okay, great. So as we talk with the folks at Atrium Health and the public health officials, the PCR, the antigen test, the rapid test, is effective in non-symptomatic individuals most of the time. However, if they do get a positive test, they will get a verification test, the PCR test, and the test results do take longer. However, they will be placed into quarantine while they are waiting those results. And so with this relationship, Atrium is one of the largest health systems in Charlotte, and they have large testing capacity, and they are able to get us the results back. The date, the time will vary depending upon the number of tests that they're doing, but we expect that we will have those tests back within 2 days. But I do apologize. I should have said that we will move them into isolation, not quarantine. So if they get a positive test, we will be moving them into isolation, which is away from all other students until we get their PCR tests back. Ms. Jones, is there anything else I should add about that?
No, ma'am.
Okay.
Say it correctly.
Does that answer your question, Ms. Montgomery?
Yes, thank you. And just so I can make sure I'm clear, isolation is at another facility, and if by chance a student has to quarantine, they quarantine in their own room, should they have a situation later after that initial test? Okay.
That's right. If there's a potential exposure, they're in their room, so they can quarantine in their room. Isolation is a facility very close to campus, but we're setting up in a hospital style and it'll be staffed by nurses 24 hours a day, 7 days a week, and they'll be taking their oxygen levels, temperature, and helping to attend to their needs while they're in isolation. So isolation is more like an infirmary or hospital. Great, thanks. Other questions?
Hi, my name's Angela Brown. I have a senior there at JCSU, and I too appreciate all the information that was covered today. I just have a few questions around the Charge Forward plan, and just why are we thinking right now is the right time to think about bringing the students back to school when Mecklenburg County is one of the hot spots in North Carolina right now. And it just looked right before Thanksgiving, there were about 38,600 positive cases. And now that we've had the Thanksgiving holiday, there are probably even more at this point. Are there concerns around that? Are we monitoring that on a day-to-day basis and willing to make adjustments considering how things go within the next, I'd say, 30 days?
Yes, we are. In fact, we had a meeting. We meet weekly with the hospital system and every other week with the health department. And so we just recently as yesterday, moved the move-in date forward to the first week in February. So we moved it forward 2 weeks because we are anticipating that, as you said, there will be cases that start at Thanksgiving, at Christmas, and at New Year's. And we want to have opportunities for people to have quarantined or recovered from the virus before coming to campus. So the classes will start off online, and students will not come to campus until about the first week in February, according to our adjusted plan. But yes, we realize it's a plan and it's very fluid. We've said all along, our plans are fluid, and we are continuously checking and revising them because we have your students' health and the health of our faculty and staff, at the top of mind.
Thank you.
Thank you.
Thank you. Are there any additional questions? I'm going to switch over to the YouTube channel to make sure I'm not missing anything over there.
Okay.
I do have just one more. The cohort assignments. I'm not looking for an assignment for white, but my son will more than likely return to campus. Do you know when the blue and gold assignments will be made? And then what about housing assignments? I believe he was scheduled to return to campus in Duke. Will his housing assignment remain the same, or will he need to do something else?
So Dr. Morgan can address the academic cohorts, and Mr. McPherson will talk about housing assignments.
Ms. Montgomery, hi. When your child registers for classes for spring 2021 and working with the advisors, that's when they will select whether they're going to be in the gold cohort or the blue cohort. And there, for every course that he or she would sign up for, they would sign up for, it would be a section designated as a blue section or a gold section.
Okay, thank you.
You're welcome.
Hi, Ms. Montgomery. This is Terry McPherson. Your son will keep the same room assignment that he was assigned for the fall. That room assignment will move over to the spring. And I also saw in the chat that someone had a question about traffic and the flow of traffic for move-in. We have planned to move students in by buildings and by floors and by times. And so when your son or daughter receives their housing assignment, they're going to be given a 2-hour window of time to check in. And we're going to stick to that time. And we're going to expect for students and whomever it is that's helping them to complete their check-in process in that 2-hour period so that we can reduce the density of people in the building. So you have a check-in time by floors and a date by buildings.
Hi, I have another question. In regards to your 2-hour check-in time, this will be my 4th time moving my student in. And is 2 hours really a feasible time frame? Because I have definitely seen people take a lot more than 2 hours. So how do we plan to manage that time frame and allow parents and students enough time to get things moved in?
Yes, good question. Thank you, Ms. Brown. Yeah, we are going to monitor it through the staff that's working in that particular building. We will know when you came in and how long you have to be checked out. We're also asking that you don't bring a lot of stuff this year. We've seen in the past that students bring, their whole bedroom and, all these items that will, it's not really a necessity. Now, your television, your refrigerator, your hygienic products, things like that, of course, in your linen. But we're asking that students reduce the amount of items that they bring. So if we do have to abruptly check out and we have to pivot, we want you to have less things to pack up and have to return home. But yes, we've seen in the past where students and parents, they take their time because they weren't given a window of time to check in. And we've also looked at other universities and our colleagues and what they're doing. And the majority are giving a 2-hour window of check-in time.
Mhm. I would just add to what Mr. McPherson said is that when everyone will be scheduled to come to the residence hall. So you won't have a big buildup of traffic at one time. So there will be a schedule that's spread out throughout the day to help with the backlogs and the traffic backups. Someone asked in the chat, are students allowed to leave campus? And yes, they are. However, we want to make sure that they follow the same guidelines that they're asked to follow on campus so that they can safely return to campus and not expose themselves while they're away.
I have another question. In regards to the various apps, I think I may have counted 5 or more apps that you're asking students to sign into, or to have to log into. Some are required, some are not required. Who's going to be tracking that information? What type of logistics do you have in place to track that?
Mm-hmm. Ms. Jones, I'd like to yield to Ms. Jones on the for the apps.
The Navica app is important in order for the student to be able to get their test results. And they need to download that app. So if someone asks the question, they'll be able to show their results if they'd like to.
What about the Sensor RX app? I believe that there's a dashboard that goes into the health center so that the health center staff can help to monitor any individuals that have yellow or red. And that dashboard is one that they have access to at the end of each day.
And also, if we see a red or yellow, we will contact the student.
Mm-hmm.
And they need to download that app. So if
Hello? Nurse Jones, are you still there?
Yes, I'm here.
Oh, were you finished responding?
Yes.
Okay. All right. So I'm going to jump to the chat real quick. Coming from YouTube, there was a question about assisting students who may be moving in alone, particularly our students who are coming from areas such as California.
Yes, this year, in the past years, we have allowed alumni to assist with the move-in process. And because of COVID, we did not allow that to happen. And we also had fraternities and sororities that would assist as well. This year, we aren't allowing for others to assist with the process. If there's a box or something that you need to get up that you're unable to handle, we will see if we can give you some assistance with that. But it's going to be on that particular student to check in themselves.
Mm.
And if the cases continue to rise, will the university keep pushing back the date for move-in, or will the university shut down? That's an additional question from YouTube.
Dr. Haywood, I'll yield to you if you want to talk a little bit about what other options we've considered?
Yeah, so this is a really good question, and it's one that the planning committee, as well as administration, continues to pay attention to. And so just so you know, and I think all of us are aware, the virus is a moving target. As VP McAllister stated, we are in constant communication with our local health department, as well as Atrium Health, around the trends. I think Ms. Montgomery, your questions around the testing were right on point. And then Ms. Brown and others who've inquired about what will the semester look like. At the end of the day, the university is going to make a decision that is in the best interest of students, that prioritizes everyone's health. And so today, what you saw are the dates that we have settled on. We are keenly aware of the possibility of an incredible uptick in cases because of the Thanksgiving holiday, as well as anticipating the COVID fatigue around Christmas and New Year's. If there's anything that we could leave you all with this evening, is to be conscious and cognizant as you and your families decide on how you're going to celebrate the holidays. I think we've all received national guidance that it might be wise to hunker down and celebrate only with our immediate families. Even if you do decide to venture out, ensuring that you are wearing your mask, using your hand sanitizer, and there may be in some instances where you have to quarantine, and just be wise as you go about your day and your daily lives. I would also reiterate what Ms. Belfield said earlier. Please continue to check your JCSU email as well as JCS News if there are any real-time decisions that have to be made. But to the parent who or whomever posed this question, we do not have a specific answer for you this evening, except to say the dates that we have provided are what we are going to hopefully adhere to. I hope this helps. If not, just let me know.
Thank you. An additional question from the chat is about housing options for our transgender and gender non-conforming students.
Mr. McPherson, you're on mute.
I'm sorry, I apologize. I just put the answer to that question in the chat. So if there's a student that want to talk to us about transgender and non-conforming housing, we do have housing options for those students. And if you contact us, we will talk to you about what options we offer.
Thank you.
And Mr. Dorsey, there's another question from a parent about her daughter's residence hall room, the number of floors, communal bathrooms. In Greenfield, there are 2 wings, and on each wing there's 3 floors on each wing and a communal bathroom on each floor. So you have 6 communal bathrooms and 2 wings. And in each bathroom, you have probably, I think it's about 6 showers, about 6 sinks, and about 6 commode areas. But if you want to contact us in the Office of Residence Life, we can explain it more in detail for you.
Thank you.
One question, this is Latrell McAllister. One question I saw in the chat is, if the country begins to shut down, will the university give sufficient time to allow parents and their students to move out? And the answer, I think, has to be that we'll give as much time as we are given. So when in the spring, when we had to shut down, we began giving students more time, but then the governor came back and changed the shutdown time. And that caused some of the airplanes and flights to be canceled. So it's not always our decision about how rapidly we have to move students out. We have to consider the local and state mandates and executive orders as well. But we will be as patient as we can, given what's going on in the community.
All right, thank you. And I am also looking at a few questions regarding the compensation for housing, and will the housing fee be readjusted for the amount of time the students are on campus?
Yeah, that's a business office question.
Mr. Pearson, I'm Greg Petsky. I'm the Chief Financial Officer. The thing that we're going to look at is what the regional schedule look like compared to this new one. And if the days change that the students will be in the residence, we'll make adjustments to the charges, and we'll put a credit on their bill.
Thank you, Mr. Pesky. I'm going to continue to look through the chat. While I do that, I still invite anyone to come off mute and ask any further questions they may have.
Hi, good evening. I have a question. If it was a question someone put in the chat as well, but I don't think it got answered. If a student tests positive for, the virus or whatever, how are the parents able to be notified? How will we be able to get any information about that?
I did put an answer in the chat. It will be according to the student, because that's their medical records. They have to authorize us to give you that information.
Okay, thank you.
It probably is worth noting that the students will still have access to the internet if they are moved into isolation. So the students will be able to contact you directly if they are in fact moved there.
All right. Will the care funds from the fall be credited to the spring as well? And will students receive iPads this year?
Okay, I'll answer the first one. When you talk about the CARES Act funds, are you talking about the financial aid that you've got? And you should look at your award, your financial award letter, and that should say the amount that you got the CARES Act. It should have in both semesters. So you should see that, and you can see that on your online billing. The second question was, Mr. Dorsey, help me out.
It is a question about the student iPads. Will iPads be received this year?
Yes, for the new students, because we gave them iPads in the fall. The new students will get iPads in the spring.
All right. And there's a question about the RA move-in window. Is it the same 2-hour time limit for our resident assistants?
Yes, same 2-hour time limit for resident assistants.
All right, thank you.
Expected.
All right. Are there any additional questions? If so, I invite you to come off mute. This is a question about Duke Hall. Is Duke Hall being used as a quarantine option? If so, what happens if you are a person with pre-existing conditions and you were assigned to a room in Duke Hall? Also, there's a question about Mosaic Village, wondering how many people are allowed to live in the suite.
Right. I answered the first question about Duke Hall. I put it in the chat. There are only 2 suites there at Duke Hall, 2 empty suites that are used as quarantine. And if students are quarantined, they will be in their own suite. not with other students. And do call, it says my son, do call in certain suites. It depends on the size of the suites. We have 2 bedrooms, we have 4 bedrooms, and a few 5 bedrooms. And so whichever is designated as the suite that your son is in, if he's in a 4 bedroom, 4 students will live in that suite, each having their own individual room.
All right. I'm not sure if this question was answered by Ms. McAllister, but what happens if there's a temporary shutdown like some parts of the California that was announced today?
Latrell, you're on mute.
I see. Sorry about that. Yes. So I didn't hear what happened in California today, but as I think it's part of the orange risk level, we can go back to it. There may be a time where we have students already on campus, and we may have to go to online courses with students still in residence. And so we may have to adjust what we're doing on campus to see if conditions improve. Maybe you can tell me exactly what happened in California today. I did not see the news, but you know, our plan is that we have to be flexible. We want to be flexible and supportive of the students. And again, as Dr. Haywood said, we're really going to make decisions with the best interest of the students in mind. Our students have said to us that they want to come back to campus, but you know, we want them to be safe when they come back.
Thank you so much. There was a request to show the virtual tour link again. As I do that, I invite anyone to come off mute and ask those questions that you may have.
Hello. I have a question. I have a freshman and she's been studying online. And my question is, she's immune compromised. So she did get a notice from her rheumatologist saying that she's immune compromised. And how would that work for her? Because I know she's been telling me at first it was going to be on campus, or you need a letter, or you can stay online. So I just wanted to be clear exactly how would that work? Do I need to send a medical letter and she stays home online? Is that available? Or is it that she has to come on campus and she stays online?
So, I think it's Miss Nino, I believe that's who was speaking at the time. Your student or your child could send an email to the University Student Health Center, directly to the University Student Health Center, and provide all of the documentation to the University Student Health Center. We will then get notification that the student will be in the white cohort, and it is an option as to whether you'd like the student to stay home and continue classwork, or pay the housing fee to reside in the residence hall, but will still remain in the white cohort.
Okay, thank you.
It's not mandatory that your child is in the residence halls, but there certainly is an option for the student to be in the white cohort.
Okay, thank you. I appreciate it.
You're welcome.
Hey, I'll jump in. Can you hear me? This is William Watkins.
Go ahead.
Yeah.
Hello. Yeah, Latrell, the California instituted a 3-week shutdown. So I think that question was pertaining to if there was a 3-week shutdown, would all classes, I guess, go to remote? And would there be any planning thereafter? And McPherson, I have a question follow up. You're going to be housing quarantine, you may potentially house quarantine students in Duke Hall. I have a student that will be residing there. Are we mixing the students? Are we going to restrict the movement of those quarantine students? Because they do have a separate living space, but what about the bathroom area? They may come in contact with healthy students.
Yeah, William, I'll go ahead and take that part of the question. As you may know, in Duke Hall, each of the suites are 2 bedrooms with their own private bath. So if I'm in quarantine, I'm in my own suite and with my own private bath and kitchen. And there will be restrictions on the movement. Yes.
Thank you.
Hello, my daughter asked this question in a previous town hall, and I think you all were going to check on it, but as far as parking passes go, with everything constantly changing, and really, I know you don't know for sure how it's going to pan out, but would there be an adequate grace period if they do come to campus with a car, where she would have time to purchase that parking pass? And also, is the rate going to be reduced, since it's only going to be for now just a couple of months or so?
Yeah, great questions, Howard. Parking will be available to our upper class students. First year students will still have to put the request into the Dean of Students office by emailing deanofstudents@jcsu.edu, and I would probably get back to them within 2 days. But we have just decided that parking for students will be at a discounted rate for the spring semester. And so we have discounted the rate by 50%. And so when students arrive in the spring, they can purchase their parking pass as they normally would have, but it will be 50% less than what it has been in the past.
Okay, thank you. Now, Will, in the past, we had to go in and do that online. I usually did it in advance. So she needs to wait until after she gets there?
No, an announcement will go out to all students when they can sign up for student parking. And so as soon as an email goes out, students can begin applying for parking online.
Okay, thank you.
You're welcome.
Hi,
And
I'm sorry.
I was just going to say, this is Ms. McAllister again, and I want to make sure I fully answer the question about the what happened in California. If there is a temporary or time-specific shutdown in our state, our faculty is prepared to pivot and take all classes online for the students. So yes, that is something that our faculty is prepared to do. So if we had a specific time, like 3 weeks, as in California, our faculty is prepared. And Dr. Morgan, if there's anything else you'd like to add, please do.
As we have built in the virtual accompaniment or supplement for all of the classes that are scheduled to meet face-to-face, it should be, and I mean seamless in the sense of, if we do have to shut down for a short period of time, if it's 2 or 3 weeks, you will just begin the next class as necessary by signing in virtually to attend those classes at the time that they're scheduled to meet.
Okay, this is Lorraine Spikes. I'm in California, Los Angeles, to be specific. My son Cameron is a sophomore and part of the golf team at JCSU. And he really wants to return to campus. So but I am concerned about him returning. Obviously, things are not good here in Los Angeles. We have really high cases right now, and we are being restricted, and we are not we can't even eat out in restaurants right now outside. Everything, it has to be, they want us to stay at home. So my question is, if the school goes on lockdown there and Cameron cannot come home, are you able to house students there? Because we have no relatives over there. If he cannot fly home, is the school able to keep some students there on campus?
VP McAllister, do you want to take this one? And then yield to Mr. McPherson?
I think Mr. McPherson was about to answer.
Yeah, we will look at it on a case-by-case basis. And I think you were saying California is on a lockdown, and If we went on a lockdown, would we be able to keep the students here? We would have to look at it on a case-by-case basis.
Well, what I mean is that if the way we are in California, like, right, I know people can still fly in, but let's say worst case scenario, he can't fly home. Would you be able, if you guys are not on, if you guys lock down and we lock down, if you're able to keep him there is what my concern was.
Yeah, we would have to look at it on a case-by-case basis.
Okay, because I don't know where he would go if he can't fly home and we have no relatives there,
Right.
So let me say that we did have a few cases of that in the spring. We had to, those students were able to meet with the dean of students and talk about their specific situations. And there were some cases where students were allowed to stay here. Some students were given funds we had at the time, I'm not sure we have them now, to help them find others housing. But one thing I can say to you is that you can count on us not to turn your son out into the cold, out into the wild. Okay.
Well,
I understand.
Well, I appreciate that because he's my one and only. I have no spares. He's my only child. So
I heard the anxiety in your voice, and
yeah.
I feel your concern, but we will not put your child on the street. Okay.
Thank you.
You're welcome.
And I'd like to address the iPhone participant who's asking for clarification about our students moving in on January 8th and then going to classes online until the first week in February. The general population of students will move in January 30th through February 6th. That's Saturday, January 30th to Saturday, February 6th. Until then, students will engage in virtual teaching and learning. And then we will pause for a week to allow students to move into the residence halls. I hope that answered the question.
Mr. Dorsey, student wanted some clarity on Duke Hall. Let me clarify that for the student. Duke Hall has 2 suites that we have set aside for quarantine. That means the student may have come into contact or may not have come into contact and they're in quarantine. In those 2 particular suites that we have, there are 2 bedrooms and a bathroom. The only students that will be in that particular suite is a student if they're in quarantine. It won't be any other students. So they would not share a bathroom with the other students who are assigned to Duke Hall. Only the 2 students or 1 student who may be in quarantine. I hope that clears that up for you.
Thank you. There was an additional question about dates. I'm going to share the screen one more time to take us back to our actual move-in dates.
I have another question. While he's doing that, is it okay to ask a question? It's in regards to the students that were going to study abroad to Cape Verde. What is going on with that? What is the decision that was made regarding that as far as the refund of the finance if the student's not able to go? Are they able to get their refund back? If so, when, or who can we speak with regarding that?
So this is Dr. Matthew DeForest. I'm the interim dean of the College of Arts and Letters. The trip to Cape Verde will not be taking place as you might expect. We are in the process of making sure that all refunds are processed. There are a couple of small challenges in that because each student has different individual balances and different kinds of expenses that have and have not been paid for that. So we're having to go student by student through that process But we expect before the semester ends to have that complete.
Thank you.
Mr. Dorsey, I see here that you put in the check-in dates, and the beginning check-in date is Saturday, January 30th for the general student population. And it's going to be very important that on the date that your particular student checks into the residence hall. We're checking in by buildings, and so we're going to be checking in over a 7-day period. So students who are checking in on that particular day, it's going to be imperative that you arrive for your testing time, that you have that you've completed the apps, that you've taken the tests, that you've made 100 on the test, that you've also completed the pledge. And then once you completed those and it's verified that you've completed those and you go and take your test, your residence hall check-in is going to be assigned to your test. So the first thing that you're going to have to do when you arrive to campus, you'll have a testing time that will be on your housing assignment letter. And so you'll have to arrive prior to your testing time. I would say be there at least 30 minutes before your testing time, take your test, and if you receive a negative, then you will have a check-in time. And so the first 2 residence halls that will check in on January the 30th will be Sanders and Myers, followed by the next day will be Greenfield. On Monday, January the 2nd will be Liston and Duke Hall. On January the 3rd and 4th will be New Residence. On the 5th and the 6th will be Mosaic Village. And so there will be days set aside for each building to check in and test.
All right. Mr. Mack, while I have you, there was a question on YouTube that asks, how should students protect themselves and others while using the community bathrooms?
Okay, yeah, I would say to make sure that, you wipe down surfaces. We will have our cleaning staff cleaning on a daily basis throughout the day. I would say make sure that you have your cleaning products and you take the proper care to go in and wipe down the surfaces as you're using the restrooms.
All right, thank you. I'm also going to share the screen for our abbreviated academic calendar, just in case anyone needed a little bit more time to write down those dates. For everyone who registered for this presentation via the Microsoft Words form earlier, it'll be sent out at the conclusion of this meeting as well. And you can also catch this meeting on YouTube at our JCSU Student Affairs YouTube channel. Before we jump back into the questions, I do want to take this opportunity to encourage you to follow our JCSU Student Affairs YouTube channel and the other social media methods on the screen. We're on Twitter, Instagram. You can also email studentaffairs@jcsu or dean of students at jcsu.edu, as well as if you're an on-campus student, you can text Smithite to 8101 to get student affairs text alerts.
Mr. Dorsey, there was one question in the chat. The person said that they'd left messages for financial aid and had not received an answer back. I think if we ask them, Dr. Dean, may we ask you to make that contact with the student? Is he still here? Yes. Maybe contact Dr. Dean and he can get the message to them for you.
If the student or parent can private message me right now, I will, we can have a conversation in the chat and I'll make sure that I have follow-up for you by tomorrow.
Thank you. Are there any additional questions that have been omitted from the discussion that we have not reached in the chat? If so, I invite you to come off mute and ask a question.
I had a question. My question was partially answered.
I was asking about my daughter that is going to be staying in the Greenfield dorm. And I was wanting to know, I don't know how many rooms are on the floors, but I was trying to ask maybe if it was even considered to maybe like moving in every other room instead of every room on a single floor to kind of minimize the number of people that will be interacting on that particular floor for that day of moving in.
Right. Thank you for that question. We have given times, and so those times that they will move in, only 6 students will be checking in at a particular time, and that will allow for students to social and parents to social distance during those times. And so, we won't be able to, how can I say it, do every other room. When you have those 6 students checking in, they will have a window of time, and then the next 6 students who come to check in, their window of time will be about 40 minutes after the first students started to check in. So that will allow for some social distancing.
Okay, I understand. Thank you.
And we reduced our population in Greenfield Hall. Normally we can house 230 students, and we reduced that population down to 121.
Okay. Okay, thank you. Could you give me an estimate real quick about how many rooms are on one floor there?
There are, I believe, 30 rooms.
Okay.
On
Thank
one
you, sir.
floor. Mm-hmm.
So what's the difference is if you check in?
I think I heard a question, but I'm unsure if they cut out. Gotcha. Dr. Dean just placed in the chat about financial aid. If you have not been able to reach financial aid, please email the Dean of Students at jcsu.edu. The questions have slowed down in the chat, so I'm going to rely on questions that may be asked verbally. Are there any additional questions? If not, are there any closing remarks from our administration?
Mr. Dorsey, I did rejoin the call. I just got the last question. I'm back on.
Welcome back, President Officer.
Thank you very much. It sounds like you all have provided more than enough information in light of the fact that there are no more questions. I do want to commend you and the team in front of our parents and students for the incredible work that you've done. I hope the session has been productive. I'm sure there'll be questions to come in the future. Mr. Dorsey, I didn't know that there were that many ways to contact student affairs. I'm gonna have to get that sheet, but clearly we're trying to maintain these levels of communications with the students and parents. And I did see the note about not being able to reach financial aid. I appreciate the fact that if you reach out, I guess Dr. Moses is not on the call, but if you reach out to Dr. Dean, we'll try to take care of that. I know one of the things they've been trying to do in financial aid is to set up appointments. So that might be a better way as opposed to cold calling. That if you can reach out to financial aid and set up an appointment, and I know they have some blocks of time where they try to do that. That might be even a better means. But in the meantime, we're looking forward to seeing you. We are hopeful that the COVID-19 cooperates and allows us to all reconvene on the campus, this beautiful campus, in early February. And in the meantime, I wish you all Godspeed and have a healthy and safe holiday season. And also be safe in your personal experiences. And as our communications director, Sherry Belford, would remind me, don't forget the 3 W's. Thank you, everybody, and have a great evening. Thanks, Mr. Dorsey. Appreciate it.
Thank you.